Has your little one taken a tumble off the couch and knocked their head and you aren't quite sure what to do? Or have they started to grow a giant egg on their head and you don't know how to check whether this is okay or not? And at what point for a head injury do we need to call an ambulance? So many questions. Friend, you are in the right place though, because in this video, we're going to go through how to manage the everyday sorts of mild head bumps at home, how to recognize a concussion injury, when to see the doctor, and finally, when you need to call an ambulance immediately. Hello, I'm Kat, a registered paramedic, mum of 2 and founder of Safe Sprouts. On this channel, you'll learn many skills which will help navigate those tricky first aid situations with your little one, and some of these skills could help save their life. To make sure you stay up to date, hit the subscribe button and to also sign up to our newsletter in the link down below, where we share a lot of actionable first aid and safety advice to help protect your little ones. Now let's chat head injuries. We'll start with how to manage those everyday head bumps that happen at home. Picture this. Little Gary is cruising around trying to find his sea legs when he loses balance and bonks his head on the coffee table. Sound familiar? Now the key thing we're watching for after a head bump is your child's behaviour. Do they remain alert and interacting with you? Is their behaviour as you might expect after they've hurt themselves? For example, they might cry or they might be really angry and frustrated from all the falling over. But as long as they're otherwise behaving as they normally would, then this is a good sign. So they're crying straight away, which is a standard response. What's next? You might notice that they're growing a very fine egg on their head. Now, we want this egg to feel firm and hard, like this hard-boiled egg here. This is good. However, if the egg feels squishy, like this overripe banana here, that's not so good. We call this squishiness a boggy mass. And a boggy mass could indicate a fracture or a break underneath, so stop poking it and call an ambulance. Now, for your run-of-the-mill bumps and bruising, you can also consider using a cold compress. So wrap an ice pack in a cloth or just use a cold, wet flannel. But here's the thing. If your child doesn't want it, that's okay. Cold compresses don't magically fix a head injury, they're just for comfort. So if your child refuses one, no biggie. My kids didn't like them either until they were a little bit older. If your child's head bump leads to bleeding, apply firm direct pressure over the bleeding site with a clean cloth for 10 minutes. And I'll give you the hot tip. Head injuries usually bleed a lot, so just be prepared for this. Now, if the bleeding persists after 10 minutes, it's time to get medical advice. After a head knock, your child might also complain of a headache, in which case you can consider giving them some pain relief medication. And the most suitable is paracetamol. Please don't give ibuprofen, because if there is an internal bleed happening within the skull, ibuprofen could actually make this bleed worse. So when it comes to head injuries, paracetamol is your guy, not ibuprofen. Finally, keep an eye on your child for the next day or so. If new symptoms appear or if you're worried, then don't hold back, get medical advice. Otherwise, just continue to monitor them at home. Right, let's move on to when it's time to get some medical advice, either from your child's doctor or you take them into the emergency department yourself. And this primarily revolves around a concussion injury. So a concussion is a type of mild head injury which causes a temporary or short-term change in how the brain works. As you can see here, symptoms of a concussion come in 3 broad categories: physical symptoms, changes in emotion, and changes in thinking. Your child will also display these symptoms differently depending on what age they are. For instance, visual problems are going to be pretty tricky to assess in a baby that can't verbalize yet. Little Gary isn't about to sit up at 6 months old and state, "Mother, I have a visual disturbance," unless he's some sort of child prodigy. Again, difficulty remembering and slower thinking will also be super hard to assess in very young children, and this is where your intuition needs to come on board. If your child's behavior seems any different to how it usually is, even if you can't put your finger on exactly what is different, I want you to reach out and get medical support and advice, be it through calling your doctor, using a pediatric telehealth service, or taking them into the ED. It's really important to note that if your child experiences a head knock, that if they only briefly show signs of an altered conscious state, for example, appearing dazed and confused for a bit, but then they return to normal, it's crucial that you get them to stop what they're doing, especially if it's jumping on the trampoline or something, and stay supervising them until they've been seen by a doctor. So even if these symptoms were brief and seem to have resolved, your child still needs a medical assessment. Another point to add is that concussions may not always appear straight away. My little Alfie hit his head one night and he had a delayed concussion that didn't show up until the next day. So it's important to watch your child not just in the hours after a head knock, but in the days following that injury too. So far we've looked at when it's okay to watch your child at home and when you might want to chat to a doctor. Now it's time to get into the nitty-gritty. We've mentioned already that if the bump on your child's head feels squishy and not firm, then it's time to call an ambulance. And there's a few more occasions where we'll also call an ambulance right away. And these include if your child has received a head injury resulting from either a high-speed crash, such as a car crash or skateboard accident, or if they're under 2 years of age and have fallen from a height greater than 1 meter or 3 feet and sustained a head injury, or a height greater than 1.5 meters or 6 feet if they're over 2, even if they show no other signs. So we classify these high speeds and heights as high risk mechanisms, and your little one will automatically be medically assessed based on what happened, regardless of symptoms. A few more. If your child loses consciousness or has had a seizure or a fit after knocking their head, if they're becoming increasingly confused, or in older children, if they have any memory loss, if they're becoming less responsive and more drowsy, especially if it's not their normal nap time, if they have a severe or increasing headache, particularly if you've given paracetamol and the pain is still there, if your child is becoming increasingly restless or agitated, and last but not least, if they vomit more than once. A couple of vomits or persistent vomiting is actually a sign that there could be something more serious happening. And just a word or two on spinal injuries. Remember, the head of a child is like this big giant bowling ball size thing attached to a skinny old spine. So depending on the situation, spinal injuries can also occur with a head injury. For any suspected spinal injury, you need to call an ambulance. Signs could include any neck pain, or if your child is hesitant to move their head. They may also have weakness or numbness in more than one arm or leg. So any of these signs, then keep your child as calm and still as possible and call for an ambulance. So to summarize, we went through what to watch for in a mild head injury, basic first aid such as bleeding management, cold compresses and pain relief medication. Then we went through the signs and symptoms of a concussion and when you will need to call your doctor or drive your child to the ED. And finally, when you need to call an ambulance immediately. Stay tuned for next episode when we discuss how to prevent head injuries from happening in the first place. Remember to subscribe if you want more first aid how-tos involving your child. Thanks for joining us.